Okay, welcome back. Today we're going to be talking a little bit about the ankle, so let's start with our case. We have a young female who's perhaps slightly the worse for wear and has been involved in a tragic PFO incident, and there has been associated use of calf enhancement technology. She presents a few days later, having not been able to shave her legs for a while. Has a lot of bruising and tenderness over the lateral aspect of the ankle. You get a quick x-ray, and this is what you see, and you can see a slight avulsion of the lateral malleolus of the fibula there. Okay, so what's happening here? What's the anatomy behind all this kind of an injury? Okay, so hopefully this is going to be a world first. This is going to be the world's first emergency medicine talk on the ankle that makes no mention of the Ottawa ankle rule. We'll try that anyway and see how we get on. Okay, so this is our standard AP view of the ankle. Okay, most of you have probably heard of the ring that provides stability to the ankle, holds everything together and keeps it together. This consists of bones and ligaments that hold the mortise joint in place. Okay, there's three main parts to this. There's a lateral complex of ligaments, there's a medial complex of ligaments, and then there's a ligament more superiorly holding the tibia and the fibula together. So let's start and we'll look at these in a bit more detail, and we'll start laterally. Okay, I've tried to outline there the place of the fibula on the lateral x-ray, and there's three ligaments really that we're interested in, some more important than others. First one would be the posterior talofibular ligament, roughly found around there. Not that commonly injured, not something that we see a great deal in clinical practice. Next, we'll have the calcaneofibular ligament. It is injured commonly enough, certainly. And finally, the big one, the one that we see injured all the time, the ATFL, the anterior talofibular ligament. This is the one that we see injured quite so often in these inversion injuries that we see every day when they come into the emergency department. On the medial aspect, again, I've outlined the tibia there to show the shadow of the tibia on the x-ray. There's a big ligament complex here, triangular in shape, known as a deltoid ligament. Apparently deltoid means triangle, hence the name. It's kind of known as one ligament, even though there's multiple different components to it. It stretches all the way across, actually, to the navicular, also attaching onto the calcaneus as well as the talus. So that's the major ligament on the medial aspect that we're interested in. And then finally, completing the ring, we have this thing called the syndesmosis. Okay, so this is actually a collection of ligaments at the lower end of the tibia and fibula, joining the two together. Very thick, strong ligament there that prevents separation of the fibula and the tibia. So if you've injured that, they sometimes call it a high ankle sprain. It's the thing that you're testing when you do your syndesmotic squeeze, if any of you are doing that. So in a typically simplified format, here are some of the things that go to make up the one ring that we talked about. We have the ATFL as the main ligament that we're interested in laterally. We have the deltoid as the main ligament we're interested in medially, and then we have the syndesmosis superiorly holding things together. Okay, so those are the ligaments involved, and then the bones are obviously lateral mal, tibia, medial mal, and the talus. Okay. Phew, okay, getting some kind of boring myself with all that actually anatomy. Let's try and get back to our case a little bit. So on the left we have, this is our little schematic of what we're thinking of when we're looking at an ankle, and here's an example. We've just reversed it from our case at the beginning. Nice soft tissue swelling, a little bit of an avulsion of the lateral malleolus. So in this case, you can imagine the ATFL is probably still intact at this point. Okay, the ATFL has come under tension during the inversion injury, and it's pulled off the chip of bone from the lateral malleolus. Okay, so the ATFL is probably intact. Now, it also may not be, and it's not something we can assess simply on an x-ray if the ATFL is intact or not. So how on earth are you going to assess that? Okay, there are tests of these things. Okay, if you have a tear in your ATFL, okay, so there's your ATFL, say we've ruptured this, we've pulled off an avulsion and we've managed to completely rupture the ATFL. How do we test for this? There's a thing called the anterior drawer test. This is different from your anterior drawer test in the knee, but what it involves is really grasping the ankle, pulling it forwards and trying to see if there's any anterior translation. Are you able to separate the foot from the ankle? Now, like a lot of these tests, I'm not entirely sure of the operating characteristics of this test. I'm not sure of its value. If any of you guys are using that a lot, I'd love to hear from you. Is it going to really change decisions? Is it going to point us towards surgery? Certainly some people feel it's appropriate to repair a ruptured ATFL if they find one. So I'd be interested to know what you think about that. say if you're interested in assessing the deltoid ligament, or you're interested in assessing the calcaneofibular ligament, there's another test you can do called the Taylor tilt test. Again, this involves grasping the foot, but this time bringing about an inversion movement and seeing what separation there is. So the inversion movement is for testing the calcaneofibular ligament. You can do an eversion type test to test the deltoid ligament as well. Again, not sure of how much value this is. It does get quoted a lot, but I'm not sure if it's going to really change our management that much. So let's go on to something that hopefully has a wee bit more value. You've probably heard of the Weber classification of ankle fractures. If you haven't, you've now heard there is a Weber classification of ankle fractures. This is based on assessing the integrity of the ring we've been talking about so far. And again, I'm going to try and give you a simplified summary just to get the concept across. So on the left here we have a Weber type A fracture. Okay, hopefully you can all see the fracture line running horizontally through the lateral malleolus. Okay, so what's been happening to the integrity of our ring with this fracture? So the syndesmosis is going to be intact. There's no separation there. Syndesmosis will be absolutely fine. Medial malleolus, the deltoid ligament here should be fine as well. There's no real questions over that. The ATFL, okay, our lateral ligaments are probably actually intact. Remember, your ATFL goes tense, and it's what pulls the bone off. It's the ATFL causes the fracture. Now again, we might not do our anterior drawer test to assess that, but it's probably still intact. So at the minute, we have a break, we have a bony break in the ring just here, okay? But there's hopefully enough elements elsewhere, okay? Both bony elements like the medial mal and the ligamentous structures like the syndesmosis, deltoid and ATFL that are hopefully able to keep the ankle still together. So this would often be considered a stable injury. Unless there's a big rupture of the ATFL, you probably wouldn't rush to fix this. You can treat it with mobilization and a cast. Okay, Weber B is a bit of a different story. Again, hopefully you can see the fracture. This time the fracture is running downwards towards the level of the actual ankle joint itself. So let's assess our ring and see what the ring is like. ATFL, again, probably still intact. The ATFL's gone tense and it's remained intact, but the bone hasn't. Our syndesmosis, probably still intact as well. Okay, the fracture line runs below where the syndesmosis is. The syndesmosis is probably still intact. And as for the deltoid, now the deltoid's maybe a wee bit more questionable. Certainly, hopefully you can see there's a small avulsion there. You might want to be testing the deltoid to see if it's still intact. So now we have certainly a definite break in the ring just here, extending towards the ankle joint. But we also have a questionable break in the ring here. We'd need to test the deltoid and have a look at that. So Weber B fractures are they can go either way. Some considered stable or treated in a cast. Sometimes the orthopods want to have a look at them and maybe fix them. Certainly if there's disruption of other ligaments or other structures of the ring. Finally, we have a Weber C, usually considered fairly unstable. So let's have a wee look at the ring. The fractures are fairly obvious here through the medial malleolus and a bit more superiorly in the fibula. ATFL, again, probably still intact. The deltoid ligament, probably still intact. It certainly has pulled off a large chunk from the medial malleolus. The syndesmosis in this case will have gone. You can see, have a look and compare them. See the separation between fibula and tibia? Okay, see what I can see through here, whereas in all these other ones I'm not able to see through. So we have diastasis, we have separation of the tibia and the fibula, so the syndesmosis has been ruptured in this type of an injury. So now we have a break in the ring, certainly at the syndesmosis, and because we've lost this large bony chunk, we've also lost the bony integrity of the medial malleolus as well. So this is a type of injury probably needs a little bit of metal work. Phew! Right, that is me done for today. Let me point to you at a few things that I find really useful in doing these. One would be fairly ubiquitous. Wheelis's textbook of orthopedics is an online, freely accessible orthopedics textbook. Generally covers most topics. Feel free to go and have a look at that. I've used it a fair bit. The other source I found really useful is a website called radiopedia.org. It's another open access, kind of a Wikipedia type thing. You can go and add cases, add explanations of injuries if you want to. Also a very useful thing to have a look at, so check them out. There's also a few YouTube videos I've used for lectures for students in the past that I'll put on the website with this video too, so you can have a look at those. Okay, otherwise that is me. This is the end.